Nothing contained in this podcast should be considered a substitute for professional medical advice. This content does not represent our respective employers and is purely the opinion of the podcast hosts. We are not your personal medical providers. Sorry, friends. So, if you have concerns or are seeking a diagnosis or treatment, please seek individual advice from a healthcare provider in your area. We are not liable for any risks associated with acting upon the information contained in this podcast. This is intended for educational and entertainment purposes only, so enjoy the ride.
Please drink responsibly and in moderation. Before drinking, please be sure to be of the legal drinking age for your country. We do not encourage the misuse of alcohol.
Welcome to Medical Media Mixer, the perfect cocktail. I'm Nicole Peniston, psychologist.
And I'm Tara Prisco, physician assistant. So, we're
back.
I know you said you had flooding in your house because of a leak, but did you get flooding in your area because of the crazy rain this week?
Recently? I was away for the weekend, so...
No, Monday and today. My area, literally roads closed, flooding, can't get anywhere. So Monday, I was getting my car serviced, and I was over in Eatontown by where the old mall was, and trying to get back because it was pouring. Roads were closed, flooding. You can't go this way. You can't go that way. A lot of things in that Ocean Township area. And then today, leaving work, it was pouring from 2:30 on basically. And then there were roads closed all by me. I had to go crazy kooky ways to get home, but it's been bad.
Yeah. No, I mean, I worked from home today, so I didn't really go oot and a boot, but we only had little bits of rain, so it wasn't bad. And then it rained pretty bad Monday and Tuesday at work, but I guess where I'm at, it's kind of a little bit of a higher elevation, so we didn't really have the flooding or problems like that. I was able to get home without issue.
I guess it was just specific areas. It's just my area got
Yeah, because I had heard other people saying it took them much longer to get to work or to get home or to get places, and there were some roads closed. So I heard about it, but it didn't directly impact me, knock on fake wood.
Yeah. Well, we were in a drought, so I guess all of the rain that didn't fall decided to fall in these 2 days. So
yeah. Well, and the good thing is I just had 3 new bushes planted, so I won't have to water them.
That's good.
Yeah. Yeah.
Any other news? What makes you told me you have something. What makes you smile?
I have something
happy?
that makes me smile today.
Okay.
I didn't ask them if it's okay that I mention it on the pod, but I'm going to do it anyway. And if they don't like it, tough. There's a little bakery in my region. I'm not going to triangulate myself too much, called KK Sweets. It's a very cute little bakery. They're a French bakery. The woman who runs it, I forgot her business card, so I don't have her name in front of me, but she's French culinary trained, and they make excellent croissants and everything. I went there this morning. But what I got today that made me smile, and I haven't eaten it yet, is look at this gorgeous little, it's chocolate mousse, but the cup is also edible.
Perfect. It's a little tart.
I know, it's going to be my cup. It's a little chocolate mousse cup, and it's got some red, white, and blue sprinkles on it to be patriotic. Cute. So I'll look forward to eating that after we're done recording. That's what made me smile today. But yeah, if you look them up on their socials, they got lots of yummy stuff. I've been there a ton of times. They were actually really gracious at my last job. They donated stuff to some of the patients, and we had a cute little breakfast with them. So they're a really cute small business, and they have yummy things. So if you are in their area, they do farmers markets and stuff too. So if you ever see them, pick something up because they're good stuff.
That's cute.
We can probably link them in the show notes too if we wanted to.
I do not know what made me smile. I have to think about it.
I'm sure something made you smile.
I'm sure something did.
Somebody said fart and you smiled or something.
That's not my style. You don't know that by now? I'm not the potty humor one.
Someone said booger and you smiled. See, you just laughed.
What? I don't know. My kids are both teenager cranky today.
So they're smiling.
That wasn't smiling. I mean, work was pleasant. I have a student and I have a shadowing student. So that's fun. Lots of conversation. Actually, It was really sweet. I don't know if these young ladies are listening, but the one is a new into college and she's just shadowing. And the other one's a grad student who's in PA school, who's actually rotating with me. And the one who's in PA school was giving the other one good little advice on things, and not just on getting into schools and things, but personal advice and friends advice. And it was just really sweet to see girls helping girls sort of a thing, you know, giving really genuine, thoughtful advice. It was just very endearing, very nice. And I feel the younger generation is better about talking about like their feelings, their needs, their wants. Like she was giving her examples of how to talk to a friend and bring up a tough subject.
Aw.
It was really sweet. It was like, yeah, girls helping girls. I like it.
Yeah.
So that was fun.
That made me think of something else that made me smile. Did I tell you about my newest obsession with the newest iteration of American Gladiators?
No, I have to watch it.
So
I
it's on
should watch
Prime,
it.
and
Okay.
it's new like this year, like
Okay.
2026. Um, but what I am loving about it is they've definitely like changed tack in that like the gladiators, like some of them like still shit talk, but like 80% of the time, like whether they like win or like the competitor wins, they're always
Mhm.
like, good job, man. Like, good job this. And there's this one female gladiator. I'm blanking on her name. It's not Siren. It's something else. But she's like got the guns. Like
Okay.
huge arms, huge thighs, gorgeous though, like blonde hair, beautiful, just like facial features. And like she'll kick your ass. But then like when they like bring them down to like talk, she'll like, that was a great job. I'm really proud of you. Like,
Oh.
good job. She's like, women supporting women. I was like, oh my God.
Yes.
Like, you look like you could like step on someone and kill them. And then you're just like
You're
so
so
sweet.
sweet.
Yeah. But like a lot of times, like, there's this one who like talks shit all the time, but then like you'll see that like she'll be like, she'll give him a high five or something like behind the
Right.
scenes. But it
Right.
seems like all of them are like way more like encouraging to the
Yeah.
competitors versus like other seasons. So it's very cute.
Oh, that's nice. Yeah, I mean, I remember that from like way back
Yeah.
in the day, 80s, 90s, that show.
I mean, every time American Gladiator's on, like whether it's like the 80s, 90s, or like there were a couple versions in the 90s that sucked and the 2000s that sucked, and then this current one, like I watch American Gladiator with the enthusiasm that people watch FIFA.
Okay.
Like
You're like
it's,
cheering at the TV and like
I
screaming.
am like wrapped. And it's like, it's not me. I'm not a sport girly, but
No.
like I'm watching this and I am invested. Like I'm crying at the end.
Oh
Like
my goodness.
I don't know what about American Gladiator speaks to me. Part of it is definitely the nostalgia because, we watched it when we were kids.
Yeah.
But there's just something about it that I am all in American Gladiator style. I can
Okay.
never compete. I would never want to.
No.
But just something about it, I get obsessed with.
The more modern version of something similar, like the American Ninja Warrior, we love that one in our
Mhm.
house.
Yeah.
It's so athletic. These people have really cool stories.
Mhm.
Some people, it's their first time out doing this,
Yep.
competing. And it is. I like those kind of like, human side story. And then there's something to cheer for too.
Yeah.
It's really cute. So we like that one. I haven't watched any recent seasons, but for a while, me and the kids were into that.
Yeah. Did you see the American Gladiator documentary about like the 90s
The old
version
one?
of it?
No.
It was interesting. They talked a lot about how often and how serious both the gladiators and the competitors would get hurt. So I think like you can even tell just by the way that the current season is they're much more safety minded. Like there was one episode pretty early on where a girl like fell off, like she got knocked off, she was supposed to, and they actually like held her out of 2 competitions to like monitor for concussion before they let her come back.
So,
which like I
true
feel like
safety.
they wouldn't have done
No,
that.
not back then. No.
I mean, there was one guy, I forget, he said he like severed his entire bicep and like played in like 4 or 5 more like
Oh my
episodes, not
God.
even like games,
Oh my
like
God.
episodes before they like had him go get checked. Unless like I myself have severed my bicep. I wasn't doing sports. Like I was just trying to wash my hair and it was hard. So like
How do
it's
people
not
do this?
I mean, I did it falling down the stairs, but
Right. But like, yeah, how do these people have like the gusto to keep going with something crazy like that?
Well, that one guy, he was one of the gladiators and he's like, this was my job. He's like, if I didn't compete, I didn't get paid. He's like,
Well,
I couldn't afford to not get paid.
Yeah, I guess that's your livelihood. Then
Yeah.
that's what you're going to do.
Yeah. Which I think also probably different now as well. So
Yeah, I'm sure a lot of it's different.
yeah. But if you want a good competition show that really gets you going, my recommendation is American Gladiators. It's on Prime.
Okay. I have to check it out.
New season.
Right now I'm into my third, I don't know why I went on a theme, but my third Irish women's TV show.
Okay. Well, we had Dairy Girls.
Dairy Girls. I watch How to Get to Heaven from Belfast. That one's a lot of fun.
I haven't seen that one. Mm-hmm.
And then this one is on Apple. It's Bad Sisters. They aren't
started that.
I
thought that was Scottish, not Irish.
No, they're Irish. Yeah,
Oh,
it took me a minute to get into it, but now I'm like fully invested.
Mm-hmm.
So yeah, I don't know why I'm on an Irish women thing, but it's fun.
I love the accent, so
It's
I can't
fun.
do the accent, but I love the accent.
So yeah, the How to Get to Belfast, Heaven from Belfast, and Derry Girls are both Northern Ireland, and that's a much stronger accent. This other one's just like Ireland, and it's definitely a softer accent, easier to understand. So, but
nice.
Yeah, so that's a lot of fun.
You know, if we get enough Irish listeners, maybe we'll go there.
There you go. I would love to go there. I just want to see all the green.
I would love to go anywhere where anyone is listening to us, but I don't know if that's happening.
Oh, wait, did I tell you that like our second country right now is Singapore? Apparently.
No.
Yes. Hi to our Singapore listeners. I am so excited that there is like somebody
I don't know
out
how
there
to say anything, but I thank you.
But like who like found us and downloaded us like literally after America. It's Singapore. So I think that's pretty awesome, and it's pretty exciting. I mean, there's a couple smattering of other countries, but the top one, it's U.S., Singapore, and U.K. is really a sad third place compared to Singapore.
Sad third place. U.K. is never sad.
Yeah, but it's a lot less people. So, hey, cool. Bring us to Singapore. Let's go.
Yeah, I mean, I'll go anywhere.
Seriously.
I'll go to Delaware if the Delaware listeners want us there. I'll go.
Yes, actually, and then New Jersey is competing now with California. Seems to be listening.
Well, we
more
do
than New
need
Jersey
to take a
sometimes.
trip to wine country. So.
Oh yes, we do. We do. Girls trip for sure. All right. Well, let's move on to a drink. As I mentioned in the last episode, my horrible cluster headaches, I'm not drinking alcohol at the moment. So I'm going to give you the real drink, but I did fashion myself a mocktail. I decided last minute, like, why waste this liquor into a drink I'm not going to drink?
Well, you could have popped it in the freezer, but still.
Yeah. So I was like, let me just make myself a mocktail. But the name of our drink, made by Claude, my AI bestie.
I was like, who's that?
Is the Tilt Table-Rita. So it's essentially a margarita with a little bit of a twist. You rim your glass, you use your lime to rim your glass, and you do half in black lava salt and half in like margarita salt. So half is black, half is white, which is supposed to be a nod to the two-sided, I'm going to give away a little bit here, dysautonomia, the sympathetic and the parasympathetic imbalance.
I feel personally attacked.
So what we use is 2 ounces of tequila. I imported all of my bar ingredients into Claude, so it just names the brands that I have. So Espolón tequila, 2 ounces, and then 3/4 of an ounce of Chinola passion fruit liqueur, 1/4 ounce of triple sec, 3/4 ounce of fresh lime juice, 1/2 ounce of agave, simple syrup, whatever you got. I had the agave, so I used that, and a pinch of sea salt actually in the drink. So after you've rimmed and salted your glass, you shake everything up in a shaker and pour it into your glass with ice. It's essentially a margarita with a little bit of a passion fruit twist. For my mock-rita, I literally took out a lime, some lemonade, and half an orange and squeezed them together and salted a glass. And it's, it's got the same
sounds
notes.
Like juice, but okay.
But no, it's got the taste because the lime is tart, the lemonade is tart, the orange gives it a little sweet, the salt in there. And it's basically a faux margarita. Faux margarita? I don't know what I'm saying.
Faux margarita.
Remember, I'm on prednisone, so.
That's not an excuse. You would say the same thing if you weren't. I know you well enough.
Oh, my goodness. So you'll kind of see with the tie-in and why it's called the Tilt Table-Rita and why salt is an important part of it as we get into the medical aspect. But we'll start with the show, and I know you've watched it, so we have a lot to dish on it.
And I've also had a tilt table test.
Oh,
for a different reason, though. For a different reason, though.
Okay.
But yes, I have. And that was wild. I'll tell you, that was wild.
So we're covering the Netflix documentary, The Crash, which came out in May of this year, 2026. It's basically a big dive into this very significant case, true crime case that came in the past few years. And it's a case about a crash that killed 2 people. And basically the outcome of the case has sort of divided the internet on what's what, who's who, who's guilty, who's not. And although the documentary mentions the illness that we're going to talk about, it didn't dive deep enough into it. And so that, of course, raises some doubts for me.
Well, I think it didn't dive deep enough into it because it didn't really sound like anyone really took it seriously.
Right. True.
Yeah. It was kind of like, oh, that's another excuse.
Yeah. So, they basically show you this group of friends that's been hanging out. The main character is basically Mackenzie Shirilla. She's 17 years old. Her boyfriend, Dom Russo, one of their best friends, Davion, who's he was a football star in high school, trying to figure out what he's doing with life next. And they bring in a couple of other friends that were part of their friend group. And, this girl, Mackenzie, they show that she was definitely trying to be like an influencer, taking pictures of everywhere, the makeup, the hair, all of the Instagram, TikTok type stuff. So there's a lot of video of her just in general in life, but it's very much that put on show life. Also, I'm sure you've noticed this young woman is extremely thin, like extremely thin. Did that jump
It's
out
funny.
at you?
I'm like, but like all those bitches are thin.
She was like,
Well,
I don't know.
that came up in the trial about, oh, well, she wouldn't try to kill herself. She wouldn't even eat a McChicken.
Mm-hmm.
Like those two things have nothing to do with each other.
Yeah, they were vegetarian, doing all these healthy foods and whatever. But essentially, Mackenzie and Dom had been together for 4 years, and her parents let her move out of her house at 17 to go live with him, which I think is a little strange. So I guess she had graduated high school, but she like you and I had a late birthday, and we wouldn't have been 18 yet at that time either. And the accounts of the relationship are very mixed. Some people say they were just in love, like top of their game, everything was happy. And there are some people who say, no, there was instability, obsession, things like that, fighting, very passionate fights, love and hate, sort of.
I put it this way. They lived together. She moved in when she was 15?
No, she's 17. It was right when she was graduating high school.
No, but she had lived with him during her last year of school.
Maybe.
So she had moved in with him
year
for a while. And I'm sure you'll get into her parents, but I feel like if I'm a teenager living with my also teenager boyfriend, and neither of us have our frontal lobes fully formed, and neither of us have parental oversight, and we're using drugs and spending lots of money, there's going to be a level of toxicity that was unintentional. And then there was also some intentional toxicity.
Yeah. And the other thing too, so they talk about this healthy lifestyle. She's so healthy. She's so health conscious. But the amount of weed she smokes,
I think she was anorexic.
The amount of weed she smokes is like crazy. Like a lot.
No, I don't think she was healthy. I think she just didn't eat food.
Yeah.
Because she drank alcohol too. And there's a lot of calories in there.
Yeah.
We know this. We do this for a living.
But basically the reason that this is a true crime documentary is because on the morning of July 31st, 2022, in Strongsville, Ohio, a car traveling 100 miles per hour slammed directly into the side of a brick building.
Without braking.
So 2 of the 3 occupants died instantly. Dom, Mackenzie's boyfriend, and Davion, her friend, or their friend. And she was the sole survivor. So,
she almost didn't survive. So,
I mean, she was pretty sick. She was in the hospital. I mean, there was a recovery period. She definitely, she was severely injured.
Yeah.
And it started out with everybody, the community being around them, surrounding them, and just, this is a tragedy. But then once they started to investigate, they felt that there were too many things that didn't make sense. Because how would you, say you fell asleep at the wheel? Well, you would still, you wouldn't be hitting 100. Like, there's no way your foot would be on the pedal going 100. Or if something you were fighting in the car, it'd be swerving. There's actually camera footage of the car zooming down the street.
In a straight line.
Right, in a straight line, straight. And it basically just goes straight to a T in the road and keeps going into this building.
And that was the thing, too, that it didn't speed up until after very carefully going around a curve. So at the time of the curve, someone was in control of the vehicle.
They talked about whether there was drug use or anything like that. Yes, she smokes a lot of weed, but there was nothing, you know.
So there've been actually multiple like mini episodes of documentaries about this, and there's one I was watching the other day, and they were like, that girl smoked so much weed, like having one joint before she got in the car was nothing. So it didn't matter.
Exactly.
Yeah.
And the other thing is that night they were hanging out with their friends. They were supposed to be doing shrooms.
But they actually ended up not doing them.
Right. So there was none because they ended up doing secondary tests on her and there was no psilocybin in her system.
But she even had like the psilocybin like fully intact. So it was like their plan had been to use it, but they didn't.
Right. So that went out the window. So it wasn't intoxication. You weren't asleep at the wheel. Like
she wasn't asleep at the meal either.
At the meal
she doesn't eat any food.
She lives on air.
Yeah. You have to do that. You have to do that as an episode.
I know. You keep telling me I have to do it. But they came to the conclusion, the investigators, that maybe she did it on purpose. Maybe because their relationship was so volatile and so codependent and she was afraid of him leaving her or something came up, that she purposefully drove them into the building intending like a murder-suicide type situation with this other guy just happened to be stuck in the middle.
So this is my thing about that. I think it's definitely something that could have happened, but I don't think it was something premeditated before they got into the car. I think they got into the car. Maybe they had an argument. She's getting all upset. She's volatile. He's volatile. And she's like, you know what? Fuck you. Hits the gas real fast. And then the next thing you know, they're, you know,
in the building.
It's an accident. Yeah.
And the story about the friend Davion is just very sweet. So his whole story is that he was adopted. So he's African-American. He was adopted by a Caucasian family. They also adopted other siblings of his. His one sister, who you hear her talking about him, like it was just so sweet. You remember all of her interviews and, you know,
which I don't think it's in this documentary. It's in something else. They don't say, or maybe it is in the movie, they don't say that she's his sister until halfway through. Like the little caption always says like, went to school with Mackenzie.
Right.
And then they reveal like, oh, this is his sister.
And
which like it really didn't have any purpose. I'm like, why did they do that?
Yeah. His father was just so you know, sweet and he
was like the only sane adult in that whole documentary.
Oh, really? In the whole world. Like that whole family, like all these young kids are partying, living together, doing drugs, everything's fine.
Don't get me started on Mackenzie's parents. Their asses should be in prison too.
Right? I mean, ridiculous.
Well, they just convicted, what was that guy, that teenager who killed a bunch of people? They put his parents in prison.
Oh, really?
Yeah. Because they knew what he was doing and they didn't stop him and they were held culpable.
Yeah. So the prosecutors, you know, found text messages, social media, an incident a couple weeks before the crash where someone said Mackenzie had driven erratically on the freeway with Dom in the car. She claimed in those messages it was Dom who grabbed the wheel, but that was really never corroborated. So she was brought up on 12 felony counts, including murder, and she was tried as an adult, despite being 17 at the time of the crash. And the way this worked out, it was a judge, not the jury, that found her guilty. I don't know if she did it is that a bench trial?
She did a bench trial, yeah.
Yeah.
She opted for a bench trial, which in one of it wasn't the documentary, it was another thing I was watching. They said that in general, like this was a prosecutor talking about it, in general, that's not something that he would necessarily advise a client to do because it's riskier.
Yeah.
But apparently she figured, ain't nobody ever going to convict me.
Right.
So
she was sentenced to life in prison with the possibility of parole after 15 years, which seems like not life in prison to me. I don't know.
There's specific.
Yeah.
It's a whole thing.
So here's where this comes in. Part of her defense that she threw in was that the crash was not intentional, and her mother testified that she had been diagnosed with POTS. Postural orthostatic tachycardia syndrome.
We should also say her mother is not a medical professional.
Right. That's why I'm like, where are the experts? Where are her medical records?
The way I took that was that even her own fucking defense didn't buy it. So they're like, yeah, your mom can mention it.
Can say
like,
it. Right.
We're not going to bother finding someone to testify to it.
Because it just didn't, it it didn't make enough sense. So,
It felt like a Hail Mary pass. Like,
yeah.
bring this up at the last minute and see if it works.
Right. So basically what they're saying is, and we'll get into what POTS is, but that she passed out. She blacked out and that she didn't accelerate intentionally and it was a medical emergency.
But then your foot would come off the wheel.
Yeah, it wouldn't be. I mean, she's a tiny little thing. Her entire body's sitting on that pedal, unless you're putting muscle into it, would not make you go 100 miles an hour.
Also, and well, no, I'm not going to jump ahead because I'm sure you'll talk about it.
Okay.
But I was going to say, isn't POTS more likely to happen when you're standing?
Correct.
Yeah.
So,
unless she was standing in the car.
Yeah,
she
the
is short.
prosecution, basically said the car had sustained acceleration, like you said, and controlled turns in the seconds right before. So it makes no sense. And the prosecution said the defense never produced any documentation from any medical professionals, just like we said. So there's really nothing to go on. And then, so in this documentary, then they bring her little jailhouse interviews in. How'd you feel about her in jail?
Girl.
She was a little something.
As someone in one of these other films so astutely pointed out, she found her group.
Right?
Because she went from being an attitudey little white girl to being like a half Hispanic chula talking about stuff like this. And I was like, girl, what are you doing? That's not you. That's not how you talked this entire time with the hair up. And it's like, clearly she's trying to fit into this group, but also she's not fooling anyone. And like, are you even really part of that group? Like, those girls are probably going to beat you up when you're done.
And it just, to me, came off as very like, I'm fine. Like,
it was very put on.
Like, yeah, but also like, not like her boyfriend and her
unbothered.
Friend died.
Very
like,
unbothered.
Yeah, like there was no emotion. It was just very much like, oh, I'm in the spotlight now.
Yeah.
And I'm
yes, a lot of neck going, a lot of attitude, but it felt very theatrical. Like it felt very put on intentionally and fake. And like, honestly, like a little offensive. Like I've worked in a prison before and like there's different cliques and groups and whatever. But like, I was like, you're pretending to be like part of a group that we all know you ain't part of, girl. Like, what are you trying to do? And then like, what does that get you? That doesn't get you anything.
No, I know.
And then the other part of it was, which I don't know if you caught it because it was really subtle, but at the end, after she's done with her piece, she sits back and she looks over and says, did I say everything I needed to say?
Yes.
Her attorney her voice, her mannerisms, everything changed the minute she started talking to her attorney.
Absolutely.
Everything went back to sweet little white girl who didn't do anything wrong.
Yes.
I just really want everyone to know that there was no intention.
Mm-hmm.
What happened to your voice? Because it was totally different 2 minutes ago.
It was crazy. There's been a lot of appeals filed, denied.
The most recent one was denied.
Yeah. So this is interesting. Her defense team filed an appeal in 2024 and missed the 365-day filing deadline because they forgot 2024 was a leap year. So they filed on day 366. That's kind of funny. I mean,
it makes me question, like, do you have the best legal team? Not that I want her to have a better one, but I'm like,
does not sound like it.
They didn't know what fucking year it was and how many days you had. Like,
I don't know.
That's a cop out.
Yeah. So, POTS.
Not that I want her to have an appeal, but I would be pissed about
if
that.
like really, like you waited to the last second, you missed it by a day.
Yeah.
So what is POTS? So whether or not it explains what happened with her, it is a real thing, and you're going to hear a lot more about it, and you do hear a lot more about it, especially with the internet. And this is one of those times where there is some good. Like we talked about some of the rare diseases, finding your people, finding your connections, finding, where the specialists are. There's a community around this.
That more and more people are being diagnosed with POTS post-COVID.
Correct. We'll definitely get into that.
Yeah.
So let's break down like the words. So postural, it's related to the position of your body. Orthostatic, specifically standing upright. And tachycardia, which means your heart rate is going over 100 beats per minute. Average heart rate is 60 to 80. Over 100 is okay, but it shouldn't be when you're not doing a whole lot of action. Although Nicole and I, when we were out to dinner the other night, didn't we say something? And I looked at my heart and it was like 110 and we were just sitting having dinner. So,
yes. But we were drinking alcohol, which can increase your heart rate, and we were eating, which digestion can increase your heart rate. But what
So
I was going to say is it's not the only thing that you can have that effect to, because I have a history of WPW, Wolf Parkinson White, which is an electrical change in your heart rhythm. But that is one of the signs is when you're standing or sitting upright, your heart rate is much higher than when you're laying down.
yeah.
So that was why I had a tilt table test.
Right. So there should be some change when you change position, but it shouldn't be a drastic change.
Yeah, mine was like a 70 beat change.
Yeah.
It was significant. It was like a lot. It was like, what?
Yeah. So POTS is a chronic autonomic disorder. So autonomic, let me just give you a little what that means. Your nervous system has an autonomic system, which is basically things that you don't have to think about to do, right? Your body's autopilot, things that just kind of run, like your heart, your digestion, your breathing, sweating, things like that. And it has two things. And we've all heard of fight or flight, right? So that's your sympathetic part of your nervous system. That kicks in during stress or danger. Your heart rate goes faster, your blood pressure goes up, your digestion slows so that you can bring all the blood flow to your muscles and your pupils dilate. The parasympathetic is the opposite. That's the rest and digest. That's when you're calm, your heart rate's slow, your blood pressure comes down, your digestion is going, and that's part of like your body's recovery. They're always happening in the background and they're always sort of balancing each other. So when that autonomic system gets thrown off, basically bad things can happen. So in POTS, the body fails to properly regulate your heart rate and blood flow when you stand up. So in a normal person, when you stand up, your blood vessels constrict, your heart rate goes up a little, and your blood pressure should stay fairly stable. In POTS, that coordination isn't correct. So your blood ends up pooling in your lower body. Your heart races trying to compensate, trying to get that blood to your brain, because your brain and your heart are the only thing your body really needs blood to go to. And the brain doesn't get what it needs. And so the result is basically this cascade of symptoms that can be fairly debilitating. So we'll give you a little bit we talk about the triggers and things like that. So about 500,000 Americans are affected. I think it's way more than that. I think that's really poor estimate.
Because not everybody necessarily brings those symptoms to their medical professional.
80 to 90% are female. So there's that.
Is that because we're all crazy and it's our hormones making it up in our head?
It's women particularly 15 to 45, right in our nice crazy years.
It's our wandering vaginas.
Yes. And often actually the onset is right around puberty. So age 14 is a common place where it starts. Mackenzie claimed that her diagnosis was when she was 17. Common triggers are a viral illness.
I'm interrupting just because I don't think they actually showed any documentation that said she had it.
No.
So we don't know that she had a diagnosis formally. Yeah.
She just claimed it. So viral illness can be a trigger, 20 to 50% of cases. Surgery, trauma, concussion, pregnancy, psychosocial stressors, but COVID absolutely has made a big difference. So roughly 2 to 14% of COVID survivors developed POTS. And about 30% of patients with long COVID meets POTS criteria on autonomic testing.
Do you think it went up if people had multiple episodes of COVID?
I don't think they know. I think they're studying it. I don't think they know for sure, but I know for sure that a lot of cardiologists and neurologists are making point to write down like such and such patient had COVID, how many times, how severe, because I think they're looking for the connection of how often, if it was treated, what level it was to eventually. I'm noticing that in notes of patients going to see cardio and neuro.
I think in general, it's going to be a while before we realize the long-term effects of COVID.
Absolutely.
Especially those really severe cases that first started off, like those folks who were hospitalized or all that kind of stuff.
Yeah, absolutely. So, it starts with what we call orthostatic symptoms. So triggered by standing, you can get dizzy or lightheaded. You can have fast heart rate, palpitations, and what we call pre-syncope. So syncope means passing out. Pre-syncope is like, I'm going to pass out. You can get that blurred vision or shakiness. So that's sort of that, I'm going to go down. You don't always go down, but that's that feeling that you get. You then also can have profound fatigue, not, I'm tired, profound fatigue, um, exercise intolerance. So doing the things that we tell you to do to make things better is harder for you.
Mhm.
Brain fog, which it's a tough term because it's very tricky to
I've told you my feelings on brain fog. Having experienced it now I take it serious. Before I was like, whatevs.
yeah. I mean, I've definitely it's I think that there is a true thing of brain fog, but I think
Mhm.
the internet has made it more than
Yeah,
it
it's a
is.
catchphrase now.
Right.
And I also feel
Um,
like most people don't even realize the true impact of the brain fog until it's ended.
right.
Once they've
And they
gotten
come
back
out
to
of it.
baseline, then they're like,
Yeah.
"Oh, wow, that was rough."
Yeah.
Yeah.
Sleep disturbances, migraines, and then your GI symptoms too, because that's all part of that, remember, that
Mhm,
autonomic system. So nausea, bloating, abdominal pain, diarrhea, or constipation, things acting the opposite of what they should
mhm.
sometimes. And then chest pain can happen, shortness of breath, musculoskeletal pain, and then anxiety and a heightened somatic vigilance. So that's probably what some people who maybe aren't listening to these likely young women coming in, when they hear they're anxious and they think there's something wrong, and people are like, oh, they're just crazy,
Yeah. And
because
I just
that's
wanna
part of it.
interject here that any good cardiologist, um, consults with a psychologist because we know that when people have had heart issues or other cardiological that's not a word, cardiologic anomalies, anxiety often happens because panic can feel the same as a heart rhythm dysfunction.
Yeah.
And once you've had heart rhythm dysfunction, now you're on edge that it's going to happen again. And so it's harder to tell yourself whether it's anxiety or your heart. And so that can kind of trip it off. But I think unfortunately, we as women, it's more sooner labeled as anxiety than as
Yep.
a medical issue.
Absolutely. So symptoms are typically worse in the morning and are worsened by kind of common things that we would know: dehydration, heat, alcohol, and prolonged standing. Um, There is not a particular correlation, though, between how fast the heart is and how bad someone feels. So,
Mhm.
treating just the fast heart rate is not necessarily going to fix the whole thing. So, go ahead.
I was gonna say, I heard when I thought I had POTS, which no, I don't think I have POTS. Maybe I do. I don't know. Either way, I heard that the best way to treat it is to lay down.
Well, I mean, yes, but you can't just like lay down randomly, like, living
I mean,
life,
sometimes
right?
you can, but but I also feel like from what little I know about it, and like I said, I'm not self-diagnosing because I do have other medical issues that could have caused the symptoms that I've had, but sometimes laying down, like, you're still gonna have a POTS episode. It could last anywhere from, like, minutes to, like, hours. So, like,
Hmm.
even if you have the opportunity, "I'm just gonna go home and lay down," like, you could still feel gross for a
Right,
while.
right. So, there's very specific criteria. So, it does have a defined criteria. Your heart rate has to increase at least 30 beats per minute,
Mhm,
um, within 10 minutes of standing. So typically, like, I'll check if someone's dizzy. I always check orthostatic blood pressures and pulse.
mhm,
And if your pulse goes up more than 20 usually, or your blood pressure drops a certain amount, you that would be orthostatic hypotension. That's
mhm,
not POTS. That's just one
right,
piece of POTS that can be related to just you're dehydrated or just whatever.
mhm. Can
Um,
medications cause that?
yeah, I mean, yes. Well, the heart rate wouldn't go up. So a beta blocker can cause it to go too slow. Diuretic, I guess, theoretically, because it's going to dehydrate
Mhm,
you, but not like a direct thing.
m'kay.
Um, so the difference in POTS, though, is that your blood pressure doesn't necessarily drop. So it
Right,
doesn't meet the regular criteria for just orthostatic hypotension. It's a little bit different. It's more about the heart rate going up than about the blood pressure
mm,
dropping.
right,
Um, the symptoms have to persist for at least 3 months, meaning you get episodes. It's not constant.
mhm,
And you have to rule out other causes like anemia, thyroid disease,
mhm,
dehydration, medications, things like that. So the testing. So two things. The active stand test is you stand someone up and they watch your vitals, and basically you just stand there and keep monitoring their vitals. And within those, 10 minutes, if their heart rate goes up, then, that would be helpful with your diagnosis. and then the tilt table. So,
Do you want me to talk about
yeah,
what the
you
tilt
could
table
tell us.
is?
You could tell us about what that was like. What
Yeah.
they did to you.
So the tilt table test is exactly what it sounds like.
Yeah.
You go, the room that I was in, but when I had it, I was already admitted to the hospital. So they did it basically just to like double check. They already knew there was something cardiac going on. They did this just to kind of, I guess, rule out other potential sources. But they had already done like that regular test that I basically just said, I sat up on a gurney, my heart rate went up, they had me stand up, went even higher, laid down, went back to baseline. So the tilt table, I think, is just, they probably check it for longer. But literally you go in and it was like, I don't know if it's supposed to be, but it was like dark, like an x-ray room, kind of.
Yeah.
Is it supposed to be like that?
I don't know if it's supposed to be
Did they
dark,
just put me in the dark? I don't
they
know.
just, yeah.
But it's a big, long table and they literally just like strap you down.
Yep.
And then the table slowly but gradually like goes, so like you're standing, but you're attached to the table.
Yep.
And then it will like monitor you for a while. And then it will like gradually like tilt like different degrees to like see the changes in your heart rate, everything like that.
Yep.
I think it was just like head up. They didn't.
No, you don't go upside down.
Yeah, I didn't think. Well, no, because I'm thinking like people have. You remember those like exercise things the tilt table like, would have in their house?
Yes.
And you would go upside down. I'm like, it's not like that.
It's not like that.
Yeah.
Yeah. It's not like a ride. But yeah, that's essentially what it is.
It is a ride, girl. It is a ride.
But that can be used when the other tests, just standing and monitoring, isn't as conclusive. This is a little bit more like standardized. There are other things they can do, something called a sweat test, a skin biopsy for small fiber neuropathy. They can check certain blood levels for something called catecholamines, checking the sodium in your urine, Holter monitoring, which is where you wear a heart monitor for a period of days, an echo, which is an ultrasound of your heart, and then they can check some like autoimmune and antibody panels just to rule in or out anything else that could be causing it. But about 75% of patients have significant delays in getting diagnosed. And most are told, or at least half are told at some point their symptoms are psychogenic. So, I mean, this is one of the things I think we're finally getting a little bit more. I think COVID did change that for the better, that we're actually studying it. There's a couple different subtypes. So neuropathic is basically small fiber neuropathy. So the tiny little signals are impairing your blood vessels' ability to constrict in your lower body, and that can cause it. There's another type called hyperadrenergic. So it's one of your chemicals called norepinephrine is elevated, and they can get anxiety, tremor, and sometimes their blood pressure actually does spike when standing instead of dropping. And then the last one is hypovolemic, so low blood volume, so low circulating blood volume. And so there's something called the renin-aldosterone axis, but basically that's supposed to help balance things, and it's not doing its job. So those are little nuanced subtypes for that. And they're also looking into an autoimmune connection. So Sjogren's syndrome, post-viral things, the COVID stuff, they're working on it, but we're just not quite there yet.
Yeah.
So what can we do to help somebody who has POTS? Like we said, exercise intolerance and profound fatigue. But one of the things we actually want you to do is exercise. So you start with things that don't require you being standing. So cycling, rowing, swimming, things that you aren't running, upright, and slowly grading that exercise over months. And eventually they feel that you can get to the point where a person may not meet POTS criteria. And they actually find this to be superior to propranolol, which is one of the drugs that we use for that. So that's interesting. The other thing is expanding your blood volume. So 2 to 3 liters of fluid a day with, hence the salt in my margarita, 10 to 12 grams of sodium per day. So, salt basically raises your blood pressure and in this case helps your body to regulate a little bit better. The other interesting thing is compression garments. So compression socks or compression hose would probably be better for this, the waist high ones that basically help push blood up to your brain. Because the whole feeling of passing out is because you have in your carotid arteries these like baroreceptors that know how much pressure is there. And when it finds there's not enough pressure of blood going to your brain, your body, you passing out is your body actually its defense mechanism. It's saying,
Mhm.
if we lay flat, all the blood's going to
Right.
be evenly distributed and go to the brain. It's not, it's your body's doing it on purpose somewhat. It's one of
Mhm.
its fail safes.
Yeah, you're trying to maintain homeostasis.
Yeah. So those compression garments can keep the blood in the upper part of your body, which can help. Medication. So propranolol, which is a beta blocker, slows the heart rate. It's a non-selective beta blocker, can have a lot of side effects, but it's definitely step one in this. Something else called midodrine. We use that a lot in Parkinson's patients because they can get drops in their blood pressure. Um, and we also use it in patients who are on like lots of meds for their heart and it drops their blood pressure, but we still need them to stay on those meds. Something else called fludrocortisone, which is related to cortisone. It retains fluid in salt, which helps. Couple other things. Pyristigmine has to do with like GI side effects. It has GI side effects, but it boosts your parasympathetic tone. I've never heard of this one though. Ivabradine. I don't know what that one is. It blocks the IF channel in the heart. I guess they're studying it more with POTS, with COVID. And so one of the things now, all these hysterical women who are dizzy and anxious, what do they put them on? Sometimes antidepressants, but one specific type, SNRIs, so not SSRIs, which are just serotonin reuptake inhibitors, but SNRIs, they're selective norepinephrine reuptake inhibitors, can worsen POTS.
And I was going to say, and those are more risky because they have more interactions with other medications.
They do, and they're a little harder to come off of in general.
Yeah.
But acutely, if someone's having an acute, flare of this, basically IV saline wide open. And they say that chronic saline, like infusions, IV fluids at home is not recommended. Just because the risks of having constant IV lines or a central line, the risks outweigh the benefits. And just to kind of finish it up, a couple of overlap symptoms, which we've mentioned a little bit in our Ehlers-Danlos episodes. So hypermobile Ehlers-Danlos, go back to episode way back in the beginning. I don't remember what number that is, but it's called, what was the episode called? I don't remember.
I don't know. It had something to do with a drink.
It had something to do with dragons, my part. I don't know. But anyway, find that episode. But we talked about Ehlers-Danlos then. That is definitely linked. And 13 to 40% of people who have POTS also have hypermobility disorders. MCAS, also linked with Ehlers-Danlos. It's an abnormal mast cells, and it gives sort of allergic / GI stuff. Another thing we're still studying. And then this one you've definitely heard about. We've sort of talked a little bit about, but myalgic encephalomyelitis, which is chronic fatigue syndrome. So
that's the fancy name for it.
Yeah. So there's definitely some overlap, and long COVID has at least, I guess, brought this all into the public so we can hopefully learn a little bit more. There's technically no known mortality from it, but obviously your quality of life is significantly affected.
Right. Well, and I think there's risks like if you have really significant POTS, fall, you can
hit your
injure
head.
yourself.
Yeah, absolutely. They say about 50% of people actually improve spontaneously in 1 to 3 years, especially if they start in adolescence. Another long-term study, I guess, shows that even though they're better, 99% still had some sort of ongoing symptoms. And nearly 90% require continued non-pharmacologic therapy. So not medications, but like lifestyle changes to keep them above board. So, I don't think this girl had POTS. I mean, maybe she did, but even if she did, I don't think that's what caused this accident.
No. Well, the other thing too is like you kind of alluded to before, she's very, very thin. We know that she admittedly was not eating a lot. She could have just got dizzy, and that doesn't mean it was POTS.
Right. So as for her defense, I don't think that it has a leg to stand on, but it is a real condition that affects a lot of people.
Because the court was like, girl,
was
bye.
Like, nope. But I think it's something that's emerging, and I think we're going to hear more and more about it. Make sure though, any of our listeners, the sources you're getting the information from.
I also feel like if it had truly been something that contributed to her, we would have heard about lots and lots of other people getting in car accidents from pots.
Yeah, true.
And it's not something you hear about.
Yeah. I mean, I did have a patient who was a little old lady who drove her car into the side of a house, and
But was it because of pots?
She doesn't remember how it happened, so we aren't sure, but we think it was sleep apnea.
Sometimes we call that dementia.
No, definitely not dementia. But
I mean,
this one wasn't.
Yeah, someone falling asleep at the wheel.
Yeah, at the wheel
feels a lot more likely, just in general.
Yeah. So, but I do think, like I said, there's a lot of information on the internet. Follow some good sources, some reliable sources. I think that that's a really good way to get information. There are some people telling their personal stories, but you have to understand that one person's personal story isn't necessarily the same for all. Right. So take all of the advice with a grain of salt, pun intended. Drink your water, wear your compression hose, and don't pass out. Yeah. So, I think it's something that we're hearing a lot about now. So hopefully our listeners learned a little bit on this. And that's a crazy documentary. So go watch it.
Crazy on so many levels. Can we just talk for a minute about her crazy ass father?
Yeah. Yeah.
This man literally looked into a camera for a documentary for his child who murdered someone, whether intentionally or unintentionally, and said, well, I can't stop her from smoking weed. I can't stop her from doing anything.
Yeah. Where's the parenting? What are you doing? Like, they were so permissive. It was just crazy. And then the boyfriend's father and then his sister, she was just laying it out there. She was like, this girl, like she gave no qualms about anything.
Yeah.
There was a whole lot of
They were all very interesting family members, but the father, I mean, the mother wasn't great either, but the father by far was the most offensive.
You can't control. My kid would be locked up. Sorry.
Yeah. Well, I don't know if you've seen, because it's been all over TikTok, the recordings of their jailhouse conversations and how they speak gibberish.
Oh, really?
And use code.
Okay.
Yeah, she keeps asking her father for warm milk. What the fuck is warm milk?
Oh, that's weird. That's weird. And like nobody can understand gibberish. I mean, come on.
Well, no. So there was somebody who they basically decoded what she said. And it was basically like her saying like, nobody believes me. Like, when are you going to get me out of here? Like stuff that you would expect her to say. Like she wasn't hiding anything, any big revelations.
But warm milk. What is the code
Yeah,
word?
and it was weird because there were old text messages where she would ask the father for warm milk too. So I'm like, is this a weird inappropriate sexual thing,
that
or is
sounds...
is she just asking her dad for weed because he clearly didn't care if she was getting high, and he seems like a big old stoner. So maybe she was just asking him for weed. I don't know.
That's bizarre.
Either way, stop asking him for warm milk.
Yeah, that's creepy.
You don't want to live at home and you want to be some girl who thinks she's all that and live in an apartment and wearing designer clothes. Also, I don't believe any of those clothes were real designers.
Oh, no.
As someone who does partake of a Louis Vuitton here and there, I don't think she was wearing true Prada slippers.
No. All
No.
right. So that was a wacky ride. Pun intended as well. Sorry.
I was going to say, I don't know if that's an appropriate pun for this story.
I don't know. So let's wrap it up. Thank you for listening to Medical Media Mixer.
The perfect cocktail.
Cheers.
Cheers.
My mocktail's pretty good.
Good for you.
Salty and tart.
That's what she said. Thanks for tuning in to this episode of the Medical Media Mixer podcast. If you enjoyed the conversation, don't forget to subscribe, rate, and review us on your favorite podcast platform. Your support helps others find the show. Want to keep the conversation going? Follow us on social media. We're at Medical Media Mixer Podcast on Instagram, Facebook, TikTok, YouTube, and on Pinterest, the Medical Media Mixer board.
If you'd like to support the show and help us grow, check us out on Patreon. Patreon.com/Medical Media Mixer Podcast. And on Buy Me a Coffee, buymeacoffee.com/Medical Media Mixer Podcast. If you have a topic idea, feedback, or just want to say hi, send us an email at medicalmediamixer@gmail.com. You can also stream all of our episodes and find more info on our website, medicalmediamixer.podbean.com. We're available on all major podcast platforms, so no matter where you listen, we're there. Thanks again for listening, and until next time, keep mixing medicine and media.